Maya's first patient is a terrified 32-year-old mother badly injured in a horror motorbike crash.
Just sit. Put your head straight up.
Do you mind if I squeeze your head?
Yeah.
She's been sitting on the back of a motorbike and a car has driven into the side of the motorbike and her leg. And so it's been an injury where her leg has been crushed between the motorbike and the bull bar of a car. The forces of being crushed in between those two immovable objects have been enough probably to fracture her bones.
Hi there. I'm Maya. I'm one of the doctors. What's your name?
Nice to meet you. I'm Kirby.
Hi, Kirby.
Hi, I'm Mr. Nolan.
Yeah, no problem, lovely.
Everybody, this is Kirby. She was the pillion passenger on a motorcycle, and they were turning right at a roundabout at low speed, and a Ford Ranger has T-boned them at approximately 30 to 35 kilometres an hour. She's got a deformity to the lower 2/3 of her tib-fib.
Tibia and fibula are the bones in your lower limb between your knee and your ankle.
Everybody ready? On go. Ready, set, go. Back on go. Ready, set, go.
It's completely understandable that Kirby is in a lot of pain. Her leg is really deformed and clearly very swollen.
On go. Ready, set, go. Well done. Okay. All right. So just...
I just want to sit up a little.
I know you do.
The green whistle is for pain relief, but it hasn't taken the edge off Kirby's agony.
Breathe on in through the nose and out through the mouth. Ah, there you go. Good job. That's helpful.
The types of injuries that she has put her at risk of a certain type of complication of those injuries called compartment syndrome. In other words, the swelling around the fractures of the lower part of her leg are putting a lot of pressure in a compartment that can't expand.
We're going to get you some more pain relief in a second, okay, lovely? We're just popping you up to the monitor.
If Kirby does have compartment syndrome and the pressure is not relieved quickly, she will suffer lasting damage to the nerves and muscles of that limb, and that will cause problems with the function of it into the future.
Up on the hospital rooftop, air ambulance is touching down with a critically ill man on board.
Emergency, Caitlin speaking.
The unconscious 70-year-old surfer has been rushed in from Warrnambool, 400 kilometres away in southern Victoria.
What we know so far is there's a patient who has been rescued from the surf. All right, so who we got in here? So I'm going to team lead. Martin will be in here as well.
Registrar Dr Caitlin Young takes the lead, with her mentor and senior emergency doctor, Martin Dutch.
So really all we know is that they're post-arrest.
I met Martin approaching about 2 years ago now while I started working in the emergency department at the Royal Melbourne. He is such a wealth of experience and knowledge, but also is really fun to work with and really an excellent mentor.
We're just coming in here.
The patient's on life support after a cardiac arrest on his surfboard.
Great, so we'll get him down, we'll get him across on your ventilator, and then we'll hand over up here.
This patient is absolutely critically unwell. He would be in our highest level of injury or illness. We know that an arrest out in the community, the rate of survival is incredibly low.
Go, ready, set. So guys, this is Gary. Gary is a 70-year-old male today, approximately 9 o'clock in Warrnambool, near Warrnambool Surf Life Saving. Some reports have been witnessed to be surfing. The next second, some observed seizure activity, and then assistance from people in the water to get him out of the water onto the land.
Gary was clinically dead for 7 minutes before he was brought back to life by his surfing mates.
Once they got him to the beach, they started CPR, even got a defibrillator, which is the machine that we use to try and restart the heart from the Surf Life Saving Club, which is just a really fabulous job and exactly what they needed to be doing. How are we going so far, the primary survey?
Starting with ultrasound, Dr Martin looks for signs that the 70-year-old's heart is beating properly.
Gary's heart's beating very sluggishly. The heart doesn't look like it's contracting particularly impressively.
Yeah.
Looks a bit
Dodgy.
Indeed.
Okay.
Gary could certainly have more cardiac arrest. We don't know why this has happened in the first place. So we're absolutely looking for any complications that may indicate that he's deteriorating.
So we really know no past medical history, no allergies.
He's got a horrendous amount of sand in his eyes, like a horrendous amount.
Before being rescued, Gary was dumped and pummeled by the surf.
Going to need to do some corneal care. That sand can travel into all sorts of places that you don't want. Some of that may have been inhaled into his lungs. The sand makes it difficult for us to do our ultrasound.
Yeah, it's a lot of sand, isn't it?
It sounds low priority, but a dustbuster would actually be really good. Dustbusters are routinely used in emergency departments. People are normally covered in dirt, in twigs, in glass from windshields, and in Gary's case, sand.
With the surfer still needing life support, Dr. Martin and Dr. Caitlin aren't certain he'll pull through.
We know he's had a cardiac arrest, we know he's had a near drowning, but we don't know what's caused it. And then we need to think about the amount of time that he was having CPR, whether his brain was getting enough oxygen, and whether he can really recover from this.
Okay, we've got CO2 on our waveform.
This is a really serious situation. Everyone in the room is aware of what's at stake. It could be that Gary may well pass away from whatever's going on.
Now, he's quite hypertensive at the moment. What's the NORAD on?
It still remains unclear exactly what's going on with Gary. He's got a number of threats to his life currently, and his heart, while beating, is not particularly beating vigorously at the moment.
With time running out, Dr. Caitlin calls Gary's wife Eva, who has a 4-hour drive to be with her husband. But it may be too late.
So, Eva, I understand you're in Warrnambool. So I'm going to tell you a bit more about what's happened to Gary today. He's in a pretty bad way at the moment. We just don't know how long his brain has been without good oxygen.
I try and focus on making sure that they know their loved one is receiving the best care that they can be receiving, and the most important thing now is that they get to the hospital safely.
He is on that breathing machine at the moment. He's not aware of what's going on around him. So please drive carefully and we'll be looking after him until then.
We can't be sure that she'll make it to the hospital in time. We really just have to do the best we can and try and keep him as well as possible.
Probably CT brain he's going to need because he's had that seizure-like activity.
If the team has any chance of saving Gary, it's vital to find out what caused him to black out.
Has he had a bleed into his brain that has suddenly made him fall off his surfboard and be unconscious? Has he had a big stroke? And can we see any signs of these things? Because they require very different treatments.
We're just organising to get the patient to the scanner in a timely way. Anytime your heart stops, you're having a bad day. Is it all right if we go to the top of the queue?
Dr. Martin gets everyone moving. They can't wait a moment longer.
Ladies and gentlemen, if we could just start setting up to transport to CT. CT is available at the moment. I'm very worried about Gary because there's a lot that we just don't know. We don't know whether the period of time when his heart wasn't beating was so long that it's damaged his brain irreversibly. May as well take a picture down there if there's something catastrophic going on. You'll see it.
All right, are we ready to go? All right.
Keep going. Don't worry about me. We still don't know the exact cause for why Gary's heart stopped. And so there's always the potential that without warning, that could occur again, including in our CT scanner.
Can I get you to wiggle your toes for me? Can you just try for me?
In Trauma 1, young mum Kirby is in excruciating pain from a badly broken leg. But Dr. Meyer is worried it's more serious.
Can you try and move it? It's really, I know it's sore.
What if I touch it? Can you feel me touching it? You can't?
The reason that I'm asking Kirby to move her toes is just to give us a good idea whether Kirby can use her limbs, gives us a good screen of how her brain's working, whether there's any potential risk to her spinal cord.
What about up there? You feel me touching you up there? Okay, and what about in your foot?
Kirby was riding with her partner Joe on the back of his motorbike when the accident happened, smashing her leg into the bull bar of a four-wheel drive.
So I know it's really hard. I just need you to try really once for me to try and move that toe.
Can I please hold your hand?
Absolutely you can.
So when a patient asks to hold my hand, I think what she's asking is to feel like a human being, just to feel that there's somebody there who thinks of her as more than a piece of broken bones and tissue, but a person who needs empathy and support.
You want to try and move it for me? I know it's really hard. I just need you to try and move that toe. Well done. You did it. I saw that move. Well done. Good. Okay. I'm sorry that was sore. X-ray.
So the X-ray that we've got of Kirby's leg does confirm that she has fractures in her tibia and fibula, which are her lower leg bones, and also potentially of her ankle, which is lower down in the leg. And so she's got multiple parts of that lower limb that have been injured and that she will need some surgery to fix those.
Do you want to just take the leg, Tom? Yep. Ready, set, go.
As Kirby is rolled to check her spine, she starts to feel sick.
Oh,
So have a little feel down your back and you tell me if you saw where I'm poking, okay? Is there pain there?
No, just tight.
Yeah. No. I'm just going to have a little feel to check some of the nerves. Can you feel me touching down there?
Oh, she's just having a big vomit, Tom. Sorry. Oh, dear.
I'm so sorry.
No, don't apologise.
Is there a man here?
There are some men in the room.
Sorry. Sorry, ladies and gentlemen.
You're very polite for someone who's got a broken leg and feeling terrible. All right, we're going to roll back. Ready, set, go.
Well done, darling.
Oh, I'm sorry, that was sore.
It's now time to take off the bandages and see the damage to Kirby's leg.
I'm going to give some medication. Audio Academy.
She's sedated so the team can move the leg without causing pain.
Abby, do you want to open your eyes for me, lovely?
Can I hold my hand?
You're all right. You're okay. Kirby, take a big breath for me, lovely.
Dr. Meyer is concerned that Kirby's extreme pain is a sign of something more serious.
So she's in a lot of pain out of proportion to what you are seeing. So you need to put compartment syndrome on your list, guys.
It's a dangerous syndrome that might mean she'll never walk normally again.
That compartment syndrome then, of course, puts pressure on the tissues around it, including the nerves. So it's very painful. It often causes paresthesia or numbness.
She's moving her toe, but she says the foot is numb and she finds it very, very sore to move her toe. If we leave it too long and the compartment isn't released, then you can go on to get nerve damage, which could obviously have an impact on how you can walk.
Since taking on the role of Director of Emergency 4 years ago, Dr. Mark Putland has been juggling the constant demands of a department under extreme pressure.
It takes a big part of your life, but you spend a lot of hours when you're not at work still working in your head, planning and strategizing and worrying about everybody and everything.
You're right.
It's meant sacrifices for people who are close to me. That's the hardest part. So family have had to sacrifice a little bit for me to do this.
In the ambulance bay, paramedics are bringing in a 64-year-old man who's fallen 10 metres from a tree. Dr. Mark goes to check on him, concerned he could have serious injuries.
G'day, I'm Mark. I'm one of the docs. How are you?
I'm good.
What happened?
I'm a dickhead.
that's a lot of our customers, you know.
I was cutting down a bit of a tree and the branch swung back and hit me, but the problem was I was about 10 metres up with a chainsaw. So.
Jeez. A lot of emergency nurses and emergency doctors would say that there should be a ladder licence after a certain age, potentially. that's the thing that frustrates us, is that we see people using these tools that professionals use with a great deal of safety and precaution, and you put one up at home and don't put a great deal of thought into it.
You weren't in a harness or anything? This was, you're not a professional tree lopper?
No, I'm just an idiot.
Just having a bit of fun.
By the time someone's lying on our trolleys looking at our ceiling, they've got a pretty keen awareness of what mistakes they've made.
Where are you sore?
Lower back.
Lower back, OK. Don't try and move. There's a good chance you've cracked a vertebra or something.
With suspected spinal injuries, Dr Mark rushes Paul to a trauma bay, where team leader Dr Tessa Smith is being briefed.
So, Paul is a 64-year-old man. He's fallen out of the tree, hitting a large branch on the way down. He had immediate pain on landing. He said it was excruciating. It was all located to the lower back. Good movement, good sensation.
Dr Mark's first priority is to look for internal injuries.
What was your name, sir?
Paul.
Paul.
So look, with the ultrasound with Paul, I'm looking for bleeding in the abdomen, particularly from big organ injuries like liver and spleen, and for bleeding around the lung or a collapsed lung. Any of those injuries can rapidly escalate into time-critical, life-threatening things.
My name's Tessa, one of the doctors.
Thanks.
Yeah. Do you know where you are at the moment?
Melbourne.
Well, I'm just going to pull this mask up for a second to look at your face. You keep your head still, mate. Can you open your mouth for me? Beautiful, you can close it. That's fine.
Even though Paul suffered a huge blow, remarkably, he's still alert.
Remember landing on squat. Up and that. That makes sense?
Yep.
Feet up.
Okay, feet up.
Head rolled back like that, ribs flat out.
Deep breath in and out for me, mate.
There wasn't any facial injury, was there?
No facial injury. Any pain in the pelvis?
No.
That's not sore?
No.
Pain through here?
No.
Most of the pain has been spine and abdomen.
No big limbs that need, no,
Not that
they're
I
all
can
good.
see.
Oh.
I just had a
Good. All right, I'll order some scans in.
Paul's got pain across the lower part of his back after a long fall. My biggest concern's a vertebral fracture or fracture to his spinal column. Worst case scenario, this can mean permanent loss of use of his legs and inability to walk in the future.
Each year, the emergency department sees hundreds of sporting injuries. Today, young Antonio has hurt himself playing footy.
My name's Chelsea.
Nice to meet you.
No, nice to meet you too. Very polite.
My girlfriend's a midwife. Her sister's a nurse.
Oh, there you go. You've been trained well then.
It's up to emergency nurse Chelsea Jones to find out exactly what's happened.
On Antonio's arrival to the cubicle, we can see that he's quite distressed and in a lot of pain. I'm gonna pop this under so that we can let go of this.
Just do it.
The young footy player has an idea what he's done to his arm.
Oh, I reckon I'd raise an on to that. Jeez.
You reckon? Looking down, we can see that there is an obvious deformity.
X-rays of the arm have just come through, and the results are alarming.
Did you see that, Antonio?
Oh, yep, I can see that.
Whoa! Don't do things by halves, do you, Dub?
It's a shocking double break, and Antonio's prediction about which bones they are is right on the money.
You've got your radius running down here and your ulna running down this side of your arm, and Antonio had broken both of his probably down around this area. Do you at least have a good story as to how it happened? Or did you just fall over?
Oh, probably just fell over.
That's all right. We'll come up with a good one. We'll get your pain under control and then we'll come up with a better story. How does that sound?
Good.
Antonio is having trouble remembering, a warning sign for Nurse Chelsea.
While assessing Antonio, I am assessing not only the break and his vital signs, but also his neurological state. Where were you playing footy? Do you remember?
No.
No, that's all right.
What hospital am I at?
You're at the Royal Melbourne. Yeah. It does set off alarm bells for me that there may be something going on that we can't actually see, and we are concerned at this point that there may be a head injury or something more sinister going on than just a broken arm. So because you don't have a very good memory in terms of what happened with the fall, we're going to need to pop you in a neck brace and we're going to do a CT scan of your head and your neck just to make sure that nothing's going on. It could be as minor as a concussion, however, it is indicative of a brain bleed. They can be fatal.
She's going to go the head in.
In CT, 70-year-old Gary is hanging on to life after collapsing in the surf.
It's brain and C-spine, yeah?
Dr. Caitlin and Dr. Martin believe Gary's heart stopped while on his surfboard, but they don't know why.
Did he have submersion with that or not?
Yeah, so he had seizure-like movements whilst he was on the surfboard and then fell into the water, and then they pulled him out of the water.
Gary's still in a lot of trouble. This is a man who has survived a cardiac arrest where his heart has stopped. It is beating now, but we're completely in control of his breathing. He's on a breathing machine.
Something going on in that lung, isn't there?
All of these patients are unwell, but of all these patients, Gary really was the sickest patient that I've managed today. If there was something that we could do to optimise that situation, we should diagnose it quickly.
The team is hoping the scans will offer some clues as to why Gary arrested.
This, so my read was no bleed, grey-white, currently intact. Fortunately for Gary, his brain didn't show any evidence of a big stroke, and his lungs didn't show any evidence of a big blood clot, but they did show something else that was very concerning. I've never seen so much fluid in a chest before. Gary's lungs were full of water. He'd inhaled a large amount of seawater, and that can cause problems for our friends in intensive care later.
So it looked like a big aspiration. Is that?
Gary could have suffered either a seizure or a heart attack before then having a cardiac arrest.
But on the balance of probabilities, as a 70-year-old man who's been previously pretty well, never had any seizures before, it's probably more likely that this is going to be a heart attack. So he'll need to go on to have some further tests over the next few days unless things change suddenly.
You know, anyone who has an arrest can have sort of myoclonic jerking activity that more often than not gets misinterpreted as seizure activity.
Gary remains on life support as his wife Eva rushes from their Warrnambool home 4 hours away.
Should get another repeat chest x-ray at some stage. Gary is the type of patient that we train for. This is a guy who's out there, living life well, highly functional. These are the people that we desperately want to get back so that Gary can continue to surf.
According to Eva, Gary has always lived life to the full, and this year he had big plans.
He was due to go to Antarctica this week to be a crew member on a boat to sort of fulfil this lifelong dream. It's been delayed because of COVID and now we're in this situation, so fingers crossed that he makes it there another day. He was meant to be going to Antarctica on Tuesday.
If Gary had this event while he was on an Antarctic sailing event, he would have died.
In Resus Base 6, footy player Antonio has badly broken his arm and wrist.
If I touch here, can you feel that?
Yeah.
And he's still having trouble with his memory.
What month of the year is it?
While he's being examined, Mum Fiona arrives, relieved her son could walk after being tackled.
I realised it was him laying on the ground, and then I just said, just breathe. And then once I saw his legs move, and that maybe he wasn't a paraplegic because it was a pretty fierce sling.
Nurse Chelsea is worried Antonio has more than just a break because of his forgetfulness. He needs to go to CT quickly.
We want to rule out anything sinister here, such as a bleed on the brain.
Just keep your head down, darling. Yep, thank you.
After Antonio was tackled, he did hit his head quite hard on the ground and had a loss of consciousness for about 5 minutes.
So when we get to CT, what we're going to do is we're going to lie you flat, okay? And then we're going to slide you onto the table.
Chelsea's a highly skilled emergency nurse who's been at the Royal Melbourne for 5 years.
If I'm being completely honest with you, it was watching a medical show with my mum based in one of the hospitals in the UK, and I thought emergency nursing's for me. I like the unpredictability of it. I like that you never know what's coming through the doors.
1, 2, 3.
While Antonio is in CT, his family wait anxiously, worried what the scans will show.
Fortunately for Antonio, the CT scan shows that there is no big bleed and that there are no C-spine fractures either.
With a clear CT scan, Dr. Jason Gabriel Anyazar gives Antonio anaesthetic before attempting to set the badly broken arm in place ahead of surgery.
Your meds are here, Jason. I'll scribe, but if you need me to jump in as airway, Jason, or run up. I'm scribing, and to be a scribe is to ensure adequate documentation throughout the procedural sedation.
How are you doing, Antonio?
Antonio's broken bones are pulled back into alignment before the plaster goes on.
It looks relatively straight. Happy?
Yeah.
Chelsea's doing a great job at looking after Antonio, and once we've got his wrist set, hopefully we can get him off to have his definitive operation.
He's tolerated it really well, which is good.
Antonio comes from a sports-mad family, but so far, he's the unlucky one.
Antonio's our eldest of 4 boys, and out of those 4 boys, we've only had 2 breaks, which it's been Antonio.
Despite Antonio's latest injury, Mum's all for him returning to the footy field.
It's like riding a horse, you've got to get back up. Otherwise, he'll just live a life of regret. Could I have? Should I have? Yeah, so it'll be ultimately his decision, but I'm pretty sure he'll be back.
All right, you're okay, you're okay. You're all right.
In Trauma 1, motorcyclist Kirby has multiple fractures after her leg was crushed when the bike she was on and a 4-wheel drive collided.
We're nearly done. We're nearly done. You're doing a really good job.
The plaster will stabilise her leg while images are taken in the CT to prepare for a mammoth operation.
Kelly, just a bend in the knee. Yeah, perfect.
There you go. Are we good to go?
Yeah. I'll just leave that there. I'm going to bring this to tell Jasmine we've got it and walk forward.
Kirby's CT confirms that she has no other injuries, but significant injuries in her lower limb, as we've already identified, but no vascular injuries to go along with that. So the arteries and the blood supply to her leg are intact.
But for the young mum and Army education officer, there's no certainty her leg will ever be the same again.
She will certainly need an operation, and they will definitely cause her lots of ongoing rehabilitation and work to get back walking again.
And she's in the army, so that might be a big deal for her.
Dr. Jason has a moment between patients to catch up with a colleague.
Just tell her. I'm doing something nice for you tomorrow, so today's a non-romantic evening.
Aside from giving romantic advice, Dr. Jason has just received word paramedics are bringing in a teenager who's been attacked.
We've just had a call come through about a young man who's been hit with a machete to his forearm.
Hearing of a machete attack with potentially gruesome injuries, Dr. Jason calls on emergency doctor Michael Dunn to lead the case.
There's a trauma call. Sounds like isolated machete to forearm, but tachycardic.
Tachycardia is a bit of a worrying sign for us. It basically means the patient's heart rate's fast. Now that can be caused by blood loss, which is our biggest concern a lot of the time in trauma, which we have to address very quickly.
Heart rate's 130, which could be the fact that he's panicking in pain or he's lost a lot of blood. So we're going to get some blood down and get some IV access in case we need to give him some blood that he's lost. Blood, depends how bad this guy is.
Each injury is different. I mean, it's so difficult to know over the phone how bad each injury is, and you have to wait till the person arrives. So you really have to be prepared for anything as small as a simple cut to the arm to potentially an arm being nearly amputated.
Take
The young man who was attacked with a machete is just 19. His right arm bleeding badly.
The paramedics in the field have put a compression bandage on to control the bleeding.
Okay. Do you want to hop across there, you think? You be all right? Good man. Cool.
Dale's has gotten into a bit of an altercation with some people as he was going round to a car. Has allegedly been struck with a machete. He has sustained probably a good 10 centimetre lack. Looks like there's bone on view. I've taken a photo to show you.
We're just going to have to take your t-shirt off.
How much blood on scene?
I don't really know because he's walked up and down the street, a big trail for like a good 20, 30 metres.
It's difficult to say how trauma affects people. I mean, Dale in particular seems extremely calm for someone at his age who was struck with a machete.
Dale was helping out at his dad's place when a car drove up.
It's 4 guys against me, and yeah, all of them had weapons. It's just gross. It's like I looked down and then all I could see was like my literal wrist. So it was like...
The worry with these ones is they have an injury to the arm and everyone focuses on that and they have some sort of stabbing to the back that no one's checked and they're actually bleeding somewhere else. So you have to give a full head-to-toe check and make sure you're not missing anything.
With the knife, did they hit you anywhere else?
No, it's just there.
Now we're ready to take the bandage off. And the real question probably in everyone's mind is what's going to happen when we take that bandage off. Is there going to be a significant amount of bleeding? What exactly we're going to uncover and how severe the injury is going to be.
Chest is clear. All his other numbers are fine.
With the tourniquet in place, Dr. Michael and the team start to remove the bandages.
What do you think?
When we take the bandage off, we see there's exposed muscle, exposed tendons, potentially tendon injury. Thankfully, we're not seeing any bleeding arteries.
Dale, taking a photograph for your file, okay?
Yeah.
So, obviously, a little cut here. There's a little bit of a blood vessel bleeding here.
Trauma surgeon Dr. Dan Marasia is checking to see if Dale will have any permanent damage.
Just need to check to see if the tendons that are running along here are affected as well. So can you straighten your hand out like that? Good. Lift your wrist back. Perfect. And relax. And then push up against my fingers. Good. And you can feel that through there? Yep. And same as that side.
He's obviously cut through some muscle, but he hasn't damaged any major tendons, blood vessels, nerves, so...
With a wound like this, the risk of infection could be very serious. So we need to take extra precautions in the next 24 hours to make sure that that wound is going to be cleaned thoroughly and the risk of infection is minimized as much as possible.
Give me some antibiotics. Yeah. And top wear plastic surgeons. Okay.
Dr. Michael applies a plaster cast to protect Dale's arm until he gets to theatre.
I mean, I think you actually got struck at a pretty lucky spot. And I'll have to give it a good wash out in theatre and close it up. Yeah. But the fact that your nerves and tendons are fine now means we'll be fine going forward, okay? All right. Do the plastic surgeons say when they're going to operate, or do they...
No, they said they're going to...
Don't know yet. Okay. We'll get you up to the ward and that's it. Best of luck with everything, all right?
Dale is keen to put the horrifying ordeal behind him.
Just trying to get through it. Just want to go home, man. Go straight to my dad and crack open a beer. That's about it.
No previous problems with your brain, your heart, your lungs, your kidneys?
No.
Beautiful.
Down the corridor, Dr. Tessa is examining 64-year-old Paul, who may have life-changing spinal injuries after falling 10 metres out of a tree.
Cool. And who do you live with at home?
My wife.
And do you tree lock often?
No.
Okay. All right. And maybe you won't be doing it again? You're right.
I shouldn't laugh.
That's okay. All right. I'm ready when you guys are.
Under Dr. Mark's watchful eye, Dr. Tessa looks for signs of spinal damage.
Get the tree out from under you, mate. All right. I'm going to start here. We'll go to your neck after. Pain, yes or no?
No.
No. No? Are you sore down this side? Okay. Doing pretty well then. So bottom of the left ribs.
On 3, 1, 2, 3.
Just an abrasion here.
At the back or the front?
With pain in his spine, the team is concerned there may be more injuries.
So what we're going to do, Paul, you need to leave your head really still, okay? And I'm going to undo this collar.
Yeah.
So, beautiful. All right, let's put this collar on.
I'm a lucky idiot, aren't I?
You are. What we need to do, though, is some scans to see if there's anything else going on, okay? Because you've had a pretty big fall, we don't want to miss an injury in your brain or your neck. We want to be sure.
He's talking, he's not looking like someone with a brain injury, but there are some particularly nasty types of brain injuries that can develop over the first couple of hours after an injury. So brain injury is not ruled out in this case.
Paul, can you keep breathing for me now? Good, breathe slowly.
We're just getting some imaging organised, having a chest and pelvis x-ray. He'll go around to CT shortly. We just want to really make sure that he hasn't broken vertebra, done anything that's not going to heal easily.
While Paul waits for more tests, he knows he should have listened.
I just finished speaking to a mate and he said, don't really warn me about doing what I was doing, and he said, put the phone in your pocket just in case. So lucky I had the phone in my pocket.
You're holding a chainsaw. Was it going at the time?
Yeah, it was still going when I landed.
Pretty impressive that it landed.
Still in the hand.
Still in the hand. Yeah. Okay.
Dr. Mark has received the results of 64-year-old Paul's CT scans.
This is the vertebral column running down. Here's a side-on view of the body, cut sliced through.
Paul's been pretty fortunate. He's managed to not injure most of himself. He doesn't have a brain injury, but he has got fractures of his vertebral bodies of his spinal column. And the surgical procedure in question is to put in really essentially rods to fuse that level of the spinal cord. This is a job for the spinal orthopaedic surgeons to do, but Paul's come out of this doing very well considering what he did to himself.
I'm feeling lucky and feeling stupid. And I'll be in a lot of trouble when I get home.
19-year-old Dale was attacked with a machete.
Heart rate's 130, which could be the fact that he's panicking in pain or he's lost a lot of blood.
The machete left a deep gash in Dale's right arm.
It's like I looked down and then all I could see was like my literal wrist.
Just need to check to see if the tendons that are running along here are affected as well. So can you straighten your hand out like that? Good.
Fortunately for Dale, the machete missed major tendons, blood vessels and nerves.
I want to get out of here as quick as I can. Go straight to my dad and crack open a beer.
Dale had surgery to close the wound and he was discharged 2 days later.
What happened?
I'm a dickhead.
64-year-old Paul fell 10 metres out of a tree while cutting branches with a chainsaw. Dr. Mark feared Paul wouldn't walk again.
Paul's been pretty fortunate with this. What he does have is fractures to his spine, though, which will need a surgical procedure.
Ahead of his operation, Paul's hopeful he'll be back on his feet again soon.
They've indicated to me that after the operation I'll have a few days of pretty intense pain, but after that it'll settle down. And it'll take me probably about 3 months to get over it.
And he promises he won't be going up trees with a chainsaw anymore.
Bloody lucky, really. Really lucky.
Mum of two Kirby was a passenger on a motorbike which collided with a four-wheel drive.
Kirby, take a big breath for me, lovely.
Good job.
Kirby suffered terrible injuries to her leg when she smashed into the bull bar of the other vehicle.
Kirby will have weeks of recovery that will include a period of not being able to walk on her leg, then a period of slowly increasing the weight that she can put through the leg as the bones continue to heal.
I'm well, considering. Could have been a lot worse, so I'm just grateful that I'm in good hands.
After a successful operation, Kirby is on the mend, but the Army Education Officer will be off her feet for some time.
2 weeks out from my national AFL carnival with the Army. When I spoke to my boss before, he said, "Oh, well, hopefully you kick with your right leg then."
70-year-old Gary had a cardiac arrest while surfing and was brought back to life by other surfers who managed to restart his heart with a portable defibrillator.
He's got a horrendous amount of sand in his eyes.
We know that he's had a cardiac arrest. We know that he's had a near drowning. We just don't know for how long his brain has been without good oxygen.
Gary woke up 2 days later to learn that he had effectively died and been brought back to life.
I remember going down to the car park and having a look at the surf and coming back and getting changed. And maybe I remember going out there, but I don't remember really being in the water and catching the wave and coming back out again. So I don't remember any of that at all. It was a surprise, yeah. Being told I survived a cardiac arrest.
Gary's case is a good example of what we call the chain of survival. Without people learning CPR and calling an ambulance, Gary wouldn't have survived.
Gary is alive today thanks to his rescuers, doctors, and to an extraordinary set of circumstances.
The fact I decided to go to the local beach rather than somewhere where I usually go, where there's nobody, the fact there was other people out, the fact that one of them was a fireman and happened to be 5 metres away and had done it before, and there was people around them to help them. I'm very grateful that everybody put in, and here I am. Amazing.